Welcome to Nursing Edge Unscripted Saga, where we use stories to connect the past to the present and then our future as we reimagine our teaching and learning. As we celebrate the NLN Year of the Nurse Educator, we pay tribute to extraordinary nurses who've made significant contributions to nursing education. We dive into the stories of nurse educators who recognized a need, challenged traditional customs, and influenced transformative change. Welcome to part 2 of our discussion concerning Dr. Luther Christman, one of the most significant nurse reformers of the 20th century. In part 1, we discussed Dr. Christman's early life and nascent nursing career, highlighting his beginnings into the fields of academia and advocacy, as well as his experience of being a male nurse in a predominantly female-dominated profession. Let's continue to explore Dr. Christman's life in academia, where he challenged many long-held beliefs in order to propel and advance the nursing profession forward. Throughout his nursing career, Dr. Christman was a tireless champion for nursing reform within the areas of academia and clinical practice. He believed that these reforms not only benefited nurses, but also the patients they served. While he advocated for many causes during his nursing career, there were 2 issues that truly captured Dr. Christman's attention and where he subsequently focused much of his efforts. These were increasing the diversity of nurses by attracting more men and minorities into the profession, and raising the standards for nursing education. As a male nurse, Dr. Christman was in the minority of his chosen profession, an experience that actually provided a unique perspective on how the lack of diversity amongst nurses impacted society. In his own words, quote, "The recruitment of competent white women nurses should be continued, but the goal should be to attain the highest level of competence by actively recruiting from all segments of society, such as the recruiting being done in engineering, medicine, and dentistry. There will be less resistance to change as diversity permeates our profession. By raising the standard to the most competent it is possible to recruit, a built-in catalyst for change will exist. Then the image of nurses can be altered." An additional advantage of true diversity is much more exchange and interaction on the job, which can lead to a better understanding of a diverse patient population. A better understanding of cultural difference can lead to better care of patients with all their diverse needs, end quote. Dr. Christman also strongly believed in elevating the educational level of the nursing profession. In fact, he advocated for a bachelor's degree requirement for all nurses, lamented the weak clinical content in many nursing PhD programs, and called for the further establishment of Doctor of Nursing Practice, or DNP, programs. He also promoted the idea that nurse leaders should maintain clinical practice. His unification model, which he developed while serving as the dean of the Rush University College of Nursing, promotes the idea that nursing faculty or nursing leaders should possess joint responsibilities in both academia and clinical practice. As Dr. Christman wrote in 1998, quote, "What is more astonishing and deplorable is that the vast majority of nurses within university education have either no or limited contact in the health services with patients. Many nurses with graduate preparation work in academic settings or management. Because most faculty are not practitioner teachers, as physicians and dentists are, for example, patients rarely receive care from well-educated nurses. The management structure of watchers of watchers of watchers, absorbs many master's-prepared nurses, end quote. Dr. Christman attempted to address what he believed was the lack of knowledge at the bedside or in primary care nursing through the promotion of the clinical nurse specialist role. Indeed, through his practice, research, and publications, he sought to relay the value of the clinical nurse specialist, especially as it relates to patient care. A true reformer, Dr. Christman felt that nursing could not stay mired in its past, but instead must adapt to new technologies and a changing society. His ideas, which at times were controversial, caused some to view him as an educational maverick. Yet Dr. Christman remained steadfast in his beliefs, a determined advocate for the advancement of the profession, increasing diversity and knowledge, as well as achieving a future for nursing that he felt was possible. As he wrote, quote, "Those who think big do big things. Everything is difficult when it is not done, but everything is easy when it is done in service to mankind," end quote. And so the saga continues, and may our saga continue as we bring to a close this episode of Nursing Edge Unscripted Saga. Thank you for joining us, and remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.